In the context of medical billing, what is the primary purpose of an advanced beneficiary notice? And let's take a look at the choices. Also keep in mind that if you're not sure what an advanced beneficiary notice is, you could use some context clues to help you make some eliminations. So if you look at a notice, think of like a notification. So the patient is being informed or notified of something. So when we see here to notify patients, inform patients, those seem like options that we should keep in mind when we're going through. But when we look at option C and D, when it says to provide patients with a detailed breakdown on their bill, and option D to alert patients of charges in their insurance coverage, we can see that if we're not sure, that maybe option C is something that we're not going to consider, but let's go through the choices and discuss. So option A says to provide patients with potential out-of-network charges. And that sounds like it could be right, but that's actually not what an advanced beneficiary notice is, and we'll discuss that once we get to the correct option. So eliminate option A. Option B is to inform patients of procedures not covered by Medicare. And that actually is the definition of what an advanced beneficiary notice is. That's something that is involved within the Medicare process to let patients know if something's covered versus not covered, so then they can make the decision if they want to go through with something, if it's not going to be covered, if they feel like it'll be still worthwhile, and they could discuss that with their provider. So option B is looking correct here. Option C says to provide patients with a detailed breakdown of their bill, and that would be nice, but that's actually not what the advanced beneficiary notice is, so we can eliminate that. And then option D says to alert patients of changes in their insurance coverage, and that's not what it is either. So option B here is the correct option.